Good day everyone, I am Siti Raihan M. Monte, and in this video, I'm going to perform assessing the sensory-neurological system. The neurological exam includes assessing mental status, cranial nerves, motor, and sensory function, pupillary response, reflexes, the cerebrum, and the vital signs. The purpose of sensory-neurological exam is to detect the neurological disease or injury in your patient. The equipment that we are going to use is reflex hammer, cotton wisp, safety pin or needle, Snellen chart. Before the considerations before, during, and after procedure. Before the procedure, explain it first to the patient and promote cooperation. Perform hand hygiene and orderly procedure to prevent learning anything. To document after procedure, record the findings and any significant observation, as well as some unusual findings. Introduce self and verify client's identity. Explain the procedure to be the client and provide privacy. This is to gain the cooperation and lessen the anxiety of the client. Good day, ma'am. I'm Siti Rehan M. Monte. I'm your attending nurse for today. How are you feeling, ma'am?
Okay.
Are you, ma'am, Yana Saikona?
Yes.
And I'm going to perform today to assess your neurological sensory. Next is perform hand hygiene and observe appropriate infection control. This is to minimize contamination. The client's eyes should be closed. Whenever possible, testing should always be bilateral to provide baseline assessment. Light touch sensation. Ask the client to close his eyes and let him respond yes or no. When he feels the cotton wisp touching his skin with the cotton wisp, lightly touch the one specific spot and then the same spot on the other side of the body. Ask the client to point to the spot where the touch was felt. Ma'am, can you please close your eyes? Tell me if you can feel it.
Yes, in my left foot.
Okay.
My right foot.
Sensitivity to touch varies among different skin areas. This demonstrates whether the client is able to determine tactile location, point localization. Normal findings, light tickling or touch sensation. Abnormal findings, anesthesia, hyperesthesia, hypoesthesia, and or paresthesia. Pain sensation. Ask the client to close his eyes. Let him respond sharp, dull, or don't know. When he feels the sharp of the dull end of the safety pin or needle is felt. Alternately, use the sharp and dull end of the sterile pin or needle to lightly prick the hand, forearm, abdomen, lower leg, and foot. Do not test the face. Allow at least 2 seconds between each test. Close your eyes, ma'am. Tell me to sharp, dull, or don't know, okay? Close your eyes.
Sharp. 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 Sharp.
Normal findings. Able to discriminate sharp and dull sensations. Abnormal findings. Areas of reduced, heightened, or absent sensation. Map them out for recording purposes. Kinesthetic sensation. Ask the client to close his eyes. Grasp the client's middle finger or big toe by the sides and move it up and down. Have the client tell you the orientation of the middle finger or big toe. Normal findings. can really determine the position of fingers and toes. Abnormal findings, unable to determine the position of one or more fingers, toes. Okay, ma'am, tell me what toe of yours am I touching?
Big toe. Middle toe.
Olfactory cranial nerve. Test sense of smell of each nostril separately. Have the clients occlude a nostril and use various scents to repeat with the other nostril. This is to test the function of the olfactory nerve. As you can see, I have here in front of you two different kind of smell, and I'm going to test my patient. Close your eyes, ma'am, and I'm going to let you smell this.
Perfume. Alcohol.
Optic cranial nerve. Check the client's visual acuity using the Snellen chart. If the client uses eyeglasses or contact lens, let him wear it. Test the visual fields. Let the client follow your finger coming to the visual field from direction to test and inspect the optic nerve. I have here in front of you the Snellen chart, and I'm going to let the patient follow my hand. Ma'am, can you please sit down, please, so we can perform ours? Okay. Can you please follow my hand and read the letter?
E O C P P O P L.
Optic and oculomotor. Cranial nerve 2 and 3. Check papillary reaction to light in both eyes. This is to evaluate the cranial nerve. Ano tong letter na? Ano sa button?
Di mo ipagyan sa kong mata.
Oculomotor, trochlear, and oculomotor, trochlear, and abducens, cranial, nerve, 3rd, 4th, and 6th. Ask the client to follow your finger as they trace H in the mid-air to check the oculomotor, trochlear, and abducens nerve function. Okay, ma'am, can you please follow my hand? Next is trigeminal cranial nerve 5. Ask the client to clench his jaw, feel for his strength, and both the temporalis and masseter muscles. This is to evaluate the trigeminal nerve function. Ma'am, can you please clench your teeth for me, your jaw? Okay. Trigeminal and facial cranial nerve 5 and 7. Check the corneal reflex by lightly touching the cornea of a wisp of a cotton. This is to test the trigeminal and facial nerve function. Facial cranial nerve 7. Ask the client to raise his eyebrows, to close the eyes tightly, puff the cheeks, smile, frown, and show teeth. This is to test the facial nerve function. Can you please raise your eyebrows, ma'am? Can you please close your eyes tightly? Can you please puff your cheeks, smile, frown, show teeth? Vestibulocochlear cranial nerve 8th, test hearingly whispering a word or holding a ticking wrist watch into each ear. Do the Rene and Weber test as well. This is to test the vestibulocochlear nerve function. Ma'am, can you please repeat what I am whispering?
Cagayan de Oro City.
Where can you hear the sound, ma'am?
Here.
Where can you hear the sound?
Here.
More. Glossopharyngeal and vagus, cranial nerve 9 and 10. Assess and listen to the client's voice. Have the client drink a glass of water. Check if the uvula midline. Have the client say ah and observe if the soft palate rises evenly. Check the gag reflex. Drinking a glass of water will provide an accurate findings. This is to test the glossopharyngeal and vagus nerve function. Okay, ma'am, please open your mouth. Say ah.
Ah.
Accessory cranial nerve. Have the client turn his head against a resistance and shrug his shoulders against resistance. This is to test the accessory nerve function. Okay, ma'am, can you please read me the other head around? And then your shoulders. Okay. Hypoglossal. Cranial nerve 12. Observe the client's tongue for any atrophy, fasciculation. Have the client stick out his tongue and check if it protrudes a midline. Have the client press his tongue on the other inside of the cheeks. This is to examine the atrophy of a fasciculation by evaluating the hypoglossal nerve of the patient.
Gawin na may bulupad na. Gawin kasi niya.
Open your mouth, ma'am. Can you please put your tongue in the side of your cheeks and the other one, ma'am? And after that, document findings in the client and record using forms of checklists supplemented by narrative notes when appropriate. This is for the reference and baseline data. And lastly, report deviations from expected or normal findings to the primary care provider. This is to ensure the complete assessment. So, that's it for this video. Thank you for watching.